integration of other health disciplines in with it. So what's evolving is that what's coming into it is an understanding of the relationship of multiple different systems and the impact those systems have on the musculoskeletal system, which leads me to ask you, Joe, about the role of nutrition in biomechanics. So where do you see gut health and nutrition, and where does that fit when you're trying to restore a movement pattern for somebody?
It's absolutely imperative, and it's been my message for a long time, but unfortunately when people start to, especially in manual therapy, when they start to consider nutrition, we unfortunately still have people following different cults and different belief systems rather than just listening to the science and looking at the evidence-based practice with regards to the case studies that are out there as well. So for me, at a cellular level, if someone has rheumatoid arthritis of the knee and you're using all your manual skills, that's great, but we need to approach it at a cellular level. What can we do for the joint structures to actually improve that regeneration, that blueprint of those cells, like the articular cartilage? How can we get better over that period of time where we renew and replace those cells? So it's imperative, and I believe that there's a bigger bang for the buck if people are considering that cellular structure.
Well, and it's so critical for inflammation. Like some of these complex patients that we see, their stories that they come in with is, yes, they have back pain, but the next day their meaningful complaint is knee pain, and the next day their meaningful complaint is now my elbow, and then my wrists, and now my hands won't close. And it's really not about any one of those, but it's about all of those, and the story tends to direct you towards the role that systemic inflammation has on our health through that. And if we look at the scope of women's health therapists in terms of what conditions they look after, bowel, bladder, and sexual function is the umbrella part of their practice. But bowel in general is just a huge part of it. So irritable bowel syndrome is extremely common with pelvic floor dysfunction, and an irritable bowel or interstitial cystitis or any painful organ, in my clinical experience, I don't know if there's a study about this, but in my clinical experience, leads to an inhibition of your deep muscle system, in particular transversus. You breathe differently, you shut your deep system off, because who wants to squeeze a boil? When your guts are sore and you bring on your deep system, which is supposed to compress things in, create increased intra-abdominal pressure, stabilize the joints of your spine, your pelvis, and your low thorax. Well, it hurts to do that. So the brain learns, I'm not going to use that strategy. So how much of the back pain, pelvic pain, and loss of control of all those structures is because your transversus isn't working in an integrated way with the other abdominal muscles? But the driver for the transversus being shut off is the inflammation.